a group that we can actually work together, the high-intensity drug enforcement ability, from our DA, from our city, from the DEA, from the FBI, from Homeland Security, is working. But there's limitations from it. A cap for how long individuals, the federal government, would pay for you to working on a case. The coordination in between. But what I also learned is something that makes me more fearful as well. A lot of the great abilities of why we're located here centrally in California and across the nation, from Highway 5 to 58 and others, also why we think we're a great distribution center for goods and others, also means it's a distribution center for the cartels to supply fentanyl throughout the country. And how can we get out in front of that? We know some of our limitations for what the state has done for making it harder to prosecute, harder to go after, but what we're watching is individuals going after our children. And the one thing everybody should know, that with social media today, with Snapchat and others, there are people who are dying with one pill, but aren't buying fentanyl. They're buying Xanax, maybe something to keep them up to be able to study. This is one that we've got to educate our public about, all the way down to the parents, just in elementary as well. It's a scary situation. But what we really need to do is stop the poison coming from China to our borders of Mexico and the cartels bringing it to poison and kill American citizens. So there's a number of pieces of legislation that I will take back to introduce to help those who are working, but also to stop fentanyl from poisoning our country. And with that, I want to bring up the Director of Behavioral Health Services at Kern Behavioral Health, Stacy Kuahara. Did I do okay?
You did great. Hi, thank you, Congressman McCarthy, for bringing us together today. The things that we learned about are incredibly alarming. However, I think that in this crisis that we're going through, there are tremendous opportunities to be hopeful and to be better. Substance use impacts millions and millions of people every day, either directly or indirectly. And what we're seeing currently with the opioid crisis, and specifically fentanyl exposure, use, and addiction is very, very concerning. I am happy to share Narcan is safe, it is available, it is very easy to use. You are not going to hurt anybody by using Narcan if they're not having an opioid overdose. It's perfectly safe, but if they are having an opioid overdose, then you can save their life with Narcan. So treatment is available. People are out there willing to help and can help guide somebody to resources. So if you're ready to get substance use treatment services, talk to somebody, or if you want to know where you can get training or Narcan, then you can contact our access line at 866-266-4898 or go to drugfreekern.org for a tremendous amount of resources. I am very pleased to introduce next our partner in making a difference in this epidemic, Dr. Mary Barlow from the Superintendent of Schools.
Thank you. I too am very encouraged to be a part of this today, and thank you, Congressman McCarthy. We at Kern County Superintendent of Schools work with 46 different districts serving approximately 200,000 students across 8,100 square miles. So this is not a small matter to organize the number of districts and students and parents involved in this crisis. Just 2 weeks ago, one of our emancipated foster youth who was on the road to recovery, this youth had found housing and was connected to support, accidentally overdosed from fentanyl. The person was not taking fentanyl. They thought they were taking a different type of substance. Schools in Kern County know that fentanyl is a life or death situation, and we are taking it very seriously. Fortunately, we live in a collaborative county where we can partner with all of our law enforcement agencies, our recovery services, behavioral health, and others. We are now training our school staff and volunteers to be able to administer Narcan, naloxone and Narcan as the opioid antagonist, and we are having conversations with our staff and with our parents and our students to educate them at the earliest ages of the dangers that one pill can kill. We stand with Congressman McCarthy and everyone here today to confront the challenge head on. And this is an urgent community matter. All of us are part of the solution. Any family, regardless of the zip code in which they can reside, can be impacted by this crisis. So we now have the opportunity to work collaboratively in Kern County and across the nation to face this danger. And I want to introduce one of our partners, Kern County District Attorney Cindy Zimmer.
Thank you so much. And thank you, Congressman McCarthy, for bringing us all together today. I learned a lot of things today and that I think are really going to help me in my fight against this opioid crisis. I've been in law enforcement for 38 years, and fentanyl is by far the deadliest drug I have seen out in the illicit drug market. It's so much more powerful than heroin and morphine. This poison is pouring over the borders and coming to Kern County, where we are seeing cartel members distribute this down to the street level. If you want to talk about Kern County statistics for a moment, let's think about what happened in 1 year regarding the overdose deaths. We have a lot of overdoses. People go to the hospital every weekend, but as far as the overdose deaths, they doubled in 1 year from 2020 to 2021. Our cases of possession for sale or sales of fentanyl have increased dramatically in my office. And one of the ways we can look at the numbers is the statistics from my crime lab. And when someone is arrested for possession of fentanyl, it's tested. And we have 12 times the number of cases that come to our crime lab than we did 5 years ago. And how does fentanyl come? It comes in pills, it comes in powder, it's laced in other drugs, and now we're seeing it in liquid form, which is quick for injection. We are hoping, the prosecution of drug dealers has been gutted in the last 10 years by our California legislature. We are not able to now, because of AB 109, send drug dealers, people that sell fentanyl, to prison. They get county jail time unless they have a strike, a gun, or they sell near a school. So that's particularly frustrating to us. So we look to our federal partners to help us with this. We were disappointed in the last year that the California legislature had 2 opportunities to help us with fentanyl. One, increasing penalties. That was denied. And also to require drug dealers to hear an admonition in court when they're convicted that fentanyl is dangerous, and if you sell to someone and kill them, then you could be prosecuted for murder. That is not required. Although luckily in Kern County, some of our judges allow us to provide those admonitions because we are ready, willing, and able, on the right set of circumstances in the right case, to prosecute someone who peddles this poison to someone who dies. We are ready, willing, and able to prosecute them for murder. I don't think the California legislature is responsive to this opioid crisis, but I think the community is ready to do something about that. And that's why I'm so appreciative that the congressman is here today. But I'd also like to say this. Think about this when you are voting in November. Think about it. Do you want somebody representing you in the California legislature that cares about your kids and what happens to them and think cartel members should perhaps go to prison instead of 30 days in the county jail? Thank you. And at this time, I'd like to introduce one of my longtime associates, Lieutenant Dan Mcafee from the Bakersfield Police Department.
Thank you, Cindy. Good afternoon, Lieutenant Daniel Mcafee, Bakersfield Police Department. And I just want to discuss a little bit. First of all, thank the congressman for getting this meeting together. It was much needed. to talk about the problems and the issues we're facing in our community with fentanyl. And as you know, fentanyl is becoming a worldwide epidemic. We're no stranger to it here in Kern County, and some of the trends that we are seeing are what called rainbow fentanyl. They're disguising it to look like Skittles, Sweet Tarts, candy, and things of that nature. They're even packaging it in candy wrappers and things of that nature. So the reason I'm speaking today is we do have one of the most favorite holidays or festive holidays coming up with Halloween. And so I encourage all the parents out there, everybody taking your little ones trick-or-treating or that are going to be consuming candy and things of that nature this year. Make sure that you're paying really close attention to what your kids have in their buckets or their little things they're collecting candy in, and really start inspecting the things. I mean, we were told when we were younger, you know, that, hey, your parents would look at your candy and make sure it's okay before you eat it. I think nowadays it's more imperative than ever that our parents are diligent in that, because the cartels and the drug dealers are targeting our youth. And by making it different colors and conducive to making it look like candy, that's exactly what they're doing, and it's extremely dangerous. So I implore all of our parents and everybody out there that are coming up on this festive holiday to really take a look at what I'm speaking to and make sure that we're being diligent and bringing the safety of our kids to the forefront. So, thank you. Congressman?
Here, come on. Thank you. Good morning. Mark Lukey, Superintendent, Bakersfield City School District. Congressman McCarthy, thank you for the opportunity this morning to come and participate in this conversation. As a school superintendent, I urge our parents across Kern County to understand that this device here, albeit convenient for us as a cell phone, is one of the greatest dangers posing risk to our children. Know your apps, know the apps your kids are on, know who they're talking to, who their friends are. Whether it's through a telephone, cell phone, or their gaming system. This is where a lot of these early connections occur and pose risks to our children. Also, relationships, as you see something, say something. Our schools are safe spaces for our students and staff, but certainly we have to work as one community to support our students and families. And with that, I say thank you very much and turn it back to Congressman McCarthy. Thank you.
One thing I think everybody has to understand, one pill can kill. And don't think it's happening to somebody else. It could be within your own family. What we're seeing is it's being laced in every form. It's an epidemic. Today, 300 Americans will be poisoned and die from fentanyl. That's the equivalent of an airline jet coming down. But it'll also happen tomorrow and the next day and the next. If an airline crashed day after day, this entire country would say there's a crisis. Well, there is a crisis right now. It's starting with chemicals in China being sent to our southern border and cartels making billions of dollars killing Americans. Now we're finding that every city is a border city. That the fentanyl doesn't just rest with an adult buying it. It's now down to our junior highs. We have Halloween coming as well. Bakersfield City Police, just like we do many times before, it is different this year. Make sure the parents are paying attention. Pay attention to your children's social media of what they're doing as well. This is going to affect everyone, and it has to come to a stop. Today's conversation we had will not be our last, but I take away from this ideas of where I can introduce new legislation to help Cynthia Zimmer, help the DEA, help the sheriff and police department combat this. But we really have to stop as China sending it and poisoning and killing Americans. With that, let me open it up for questions, comments. Yes?
You say there's a number of pieces of legislation that you want to introduce to address this issue. Of course, if Republicans do take the House in November, you'll have oversight ability. You can investigate the southern border, Mayorkas, if you want to. But actual legislation, there's a lot of ifs there. It depends on how big your margin is in the House, what happens in the Senate, President Biden's response. What can you commit, concrete legislation, what can you commit to addressing this issue here at home?
Well, I would hope it wouldn't have to be a partisan issue, but even listening to Cynthia Zimmer, our DA, we're watching. Sacramento is making it more difficult in Kern County and California. Sacramento policies are making it more difficult that drugs are able to kill more Americans. So if we are fortunate to take the majority, the first thing we'll do is secure our border. No matter who you spoke to, no matter what law enforcement agency it was, from the CHP to the DEA to the Homeland to the county sheriff to the city police, it's coming across our southern border. It is starting in China. Secure our southern border so it's not coming up here. Secondly, make it a Schedule I drug. It's temporary like that, but the number of times we tried to put it onto the floor, the Democrats have blocked that. Thirdly, enhance the ability for our law enforcement to work together, from the FBI and others. Right now, they're capped at the number of hours of overtime, so they're working a case. But the cartels don't stop. They work 24 hours a day. So if they're working a case and they hit the cap, they've got to stop. I can enhance that. I was impressed today by how well the coordination between all the law enforcement agencies are able to work together. And think of this. There's some things on a federal level, but some things on a state level. We just watched the CHP with the Tulare County Sheriff do an amazing job to pull over 2 individuals, which I'm not sure the correct number. Was it 1 million pills or 500,000 fentanyl pills sitting in? But because of California law, because of a judge in Tulare, those 2 people never served a day. They were let out before the officers even got home. And did they show up for court that day? No. But how many thousands of Californians would have died had those pills got on the street? So yeah, there are a lot of things that will stop day one when we take the majority. Yes, sir.
Could you describe, you said you were impressed with the coordination in the county, but also could you just kind of outline for us again some of the things that you discussed in the meeting?
Well, there's some things in some cases we can't talk about, but I would just say, sitting in this room, you had the DEA, you had Homeland Security, you had the FBI, you had the Kern County Sheriff, you had the CHP, you had the Bakersfield City Police Department, you had the Police Department for the Kern High School District. Every case I talked about, they all coordinated and worked together. But they also talked about places that they had problems. They were all short on staff. You know what it was, an underlying issue of why they're short on staff? This whole movement of defunding the police. They're hard to hire individuals. They had programs they wanted to start up. And plus, we have no federal prosecutors, correct?
At this time, no.
At this time. So it holds us back. So another idea that I had for our DA and others, that they could be deputized federal prosecutors. If we're not able to hire to get them there. The DEA was running short. The Homeland Security was running short. They want to be able to bring a pilot program, just like they have in Fresno, to Bakersfield, but they're short on staff. And when I say, do you need more money, the challenge is trying to hire someone. And when you dwell into it and ask them why, they're not getting the applications they used to. People aren't wanting to go into law enforcement back to because they felt the challenge of what we're seeing on the defund the police movement out there. And in our commitment to America, we're going to reverse that. We're not going to defund the police. We're going to provide more funding to them. We're going to provide them the flexibility that they continue to work on these cases to keep us safe. And we're going to want to bring those pilot programs here. And a pilot program of what started in Fresno is about people under the age of 18 that are overdosing and dying from fentanyl, where they can go in and look from their social media and find out who's selling it to them. Get back to the people who are literally bringing it and killing it to us. That's what we're trying to find, and that's what we want to bring to the table. Yes, sir.
Congressman, we've seen a opioid crisis for years. Can you talk a little bit more about why we're having this talk, why we're having this roundtable today, and maybe also tie in the recent things we've seen in local school districts here?
Well, what we found with an opioid epidemic in the past here, it was more prescribed to you. And America woke up to that this was a deadly pill, that they were prescribing too much for you, that it was being moved onto the markets. And then we talked about treatment, how to go about that. This is something different. This is a poisoning. And now the new place of where we're seeing the poisoning, they're trying to make it look like Skittles, going after our children. We watched just recently in a junior high, and can I talk a little bit about what you told me?
Sure.
Oh. I want to give some credit to our Bakersfield City School District. The individual minor who brought those drugs on campus had only been in school for 4 days. But as they signed up to go to school, within 2 days, the Bakersfield City Schools and the campus there realized this child had some issues. They already visited his parent at home to say, not knowing that this was a problem, but knowing some situations that this kid was doing. And then when the kid came to campus, they were able to see some activity. They were able to pull him in and find the drugs before he was able to sell it on campus. That was proactive. But think about had they not been able to do that. But there are others where they're going to slide through the system that we're not going to see. We're trying to protect our children. We need to be able to have all the resources. We need the state to let us have the resources to go and stop the individuals who are targeting our children to kill them. Yes, ma'am.
For the schools, obviously there's a link between substance abuse among youth and like those who are at risk. So are you guys investing in more counseling, or like what are the ways that you are kind of identifying these kids?
Absolutely. So you might have heard about an initiative called Community Schools. Not only are we looking at bringing in more substance abuse counselors, but behavioral support services at what we call Tier 1, Tier 2, and Tier 3. Tier 1 is for everybody, recognizing that this can impact any child. And given what we've just gone through over the past 2 years with COVID, there's a lot of need for mental health supports and social emotional learning in schools. So we've augmented those supports across school districts in Kern County, and I would say that it will help, but it's not going to be the full answer. It takes all of us. It takes our parents, it takes our churches, it takes our schools, our partners to come together and not only heighten the awareness of fentanyl and the dangers of fentanyl and any type of substance use, but to get to the underlying issues for why these students are feeling like they need to turn to that type of substance.
Do you have a timeline for when we're going to see that augmentation of
Mark might
counselors?
want to come up here as the superintendent of BCSD.
Yeah, so let me kind of go backwards to go forward. So in our district, we have what we call the Family Community Engagement Department, who work with our parents across a myriad of educational topics, both school education as well as trying to improve our parents' skills, make them employee ready, et cetera. We also have behaviorists in our schools. All of our schools have one, 42 of our additional schools have 2 staff members, and their role is to really support students who are going through anxiety or emotional distress, who have needs. Congressman McCarthy talked about prevention. We work as quickly as the school year, because for us, it's a long weekend. Kids were with us before, they come back to us at the start of the school year, they have a history with us, we know them, so we work to support them. In this case, student enrolled on a Tuesday after Labor Day, and by that Friday, we were very aware that there were some things going on there. So it's a coordinated effort. It's like a giant orchestra of pieces coming together to really help support our students and our families. And serving kids TK through 8th grade, 5-year-olds to 13-year-olds, we need our parents to work as partners. And part of that too is if you see something, say something. We have a myriad of resources and tools, from anonymous reporting applications that parents, students can just share what's going on. Kids are very aware of what's happening around them on campuses, and so we work to build those close relationships to get kids to tell us things. Community schools, it's a powerful initiative that the state has supported. This is all about making our schools the hubs of services and supports for all things that kids and families need. And so we have 4 schools in our district that have been identified with grant funding: Emerson, McKinley, Stella Hills, and Martin Luther King Jr. Elementary, where we are working to build and strengthen community partnerships to offer those 4 schools that have immense needs in our community, but also have a school wellness center where kids can get medical care, dental care, vision support, and mental health support as well. And then partnerships with Kern Behavioral Health. We are working to pilot some key curriculum on suicide prevention as well as drug awareness. And again, we have to start as young as kindergarten nowadays to really just make our folks aware of what's happening. Unfortunately, that's the reality where we are. But I do believe that our parents are extremely supportive of our work. They just don't know how or where to go. And we have to be better about connecting parents with those resources.
You mentioned
Question?
Yes. Go ahead.
I did have a question for Mary. This is in regards to, the hot topics specifically focused with parent flag aimed mostly towards, KHSD districts, specifically with North High, all the opioid overdoses. One of the biggest things parents have said is that the school, the district, and, superintendent of schools, hasn't been doing enough to protect the students. And a lot of parents have gone on record to say they don't feel like their students are safe, even just going to school nowadays. And with Halloween right around the corner, homecoming dance is just, finishing up right now. Drug use, continuing to be on the rise. Parents even going onto campus and witnessing drugs being used, and teachers' hands are tied. What can you tell the parents? What can you tell people at home to give them some reassurance that school is still safe when North High has had 5 confirmed overdoses, fentanyl overdoses, and maybe even 6+ more unconfirmed overdoses as of right now? What can you tell these parents?
Well, I can tell them that school is one of the safest places in our community, but let's face it, there is no safe place where fentanyl and other drugs will not be introduced to students and children. That's the fact of our current society. So we at the school districts are doing everything we can to educate all of our students, our parents, and our staff about what to look for, what to notice in the classroom or on the campus, and how to intervene and connect parents and students to those support services. We're gearing up. We've been doing it, but we have to heighten our training and our support services and put Narcan in every campus. We're at a place where we're in a different world than where we were even 5 years ago. And this is deadly, this is a crisis, and we need to address it head on.
And then can I just ask one really quick follow-up to that? One of the other big issues that parents have asked is, can Narcan be allowed on campus with their own children? I know North High went a little rogue recently and has announced that they will allow students to have Narcan, but will other districts follow? Can kids bring Narcan with them? Would that be allowed?
So again, 46 different districts. Every single district has an elected board, and they have an opportunity to look at and develop the policies that are required in order to train and have Narcan on campus. So I will tell you that everyone's looking at it. Had a training just last week with all of our schools' legal service and superintendents in the room. There wasn't one superintendent who wasn't interested in getting that information and bringing it to their board to address this issue.
Excuse me, this might be for Lieutenant McAfee. We're talking about Halloween, and it's coming up so soon, and people actually come across candy at school even before Halloween arrives. Is, parents examining candy, what can they look for? I mean, is it visible if somebody treats candy, or does this look just like a bag of Skittles?
Well, they kind of, you can start with the packaging. If the packaging looks different, just looks odd, that's one thing they can do. I don't think it's gotten to the point they're that sophisticated where it actually looks like a Skittle. So they've started with the coloring, the rainbow, fentanyl, and things of that nature. We talked about a case in New York City where 500,000 fentanyl pills were smuggled in a box of Legos. So the reason that they're coloring it like that, because it's harder to detect and it's easier to get in to the country and to neighborhoods and everything like that. So again, I just want the parents to be diligent when their kids are trick-or-treating. If something looks out of sorts, then it probably is out of sorts. So that's what I want them to look for. I want them to pay attention a lot closely than they have in years, because again, this is something completely different that we've dealt with opioid crisis in the past, but this is something a little more escalated and a little more dangerous than what we've seen in the past, because people take one dose and that could be potentially life-threatening. So again, we just want the parents, we're not trying to create a frenzy, but we do want them to be diligent when their kids are out there trick-or-treating. We want them to have fun and enjoy the holiday like we all have, and we do every year, but I just want them to pay a little closer attention and be a little more diligent and look for those things that kind of looks out of sorts. And if it does, then give the police department or the right resource a call and let us come take a look at it, let us examine it, and let us try to find the origin. But again, it's not to create a frenzy, but just to be diligent on this particular holiday with the things that are going on.
This is an epidemic. Our number one thing we do is stop it from coming to this country. But right now it's there, so how do we deal with it, and how do we make sure our children are safe? Yeah, last question.
Yeah, last question. For Mary and Mark, kind of piggybacking on Marco's question. So I know you're saying every school district different. I understand that. So we see fire drills, earthquake training. These are regulars. But there's talk about Narcan training, not just the staff, but the students being a regular practice.
Yes, there's a variety of resources that have been developed across the state and within our county. They're being distributed to school districts, superintendents, and their principals to then look at how they implement them in their school sites. Each and every school district will need to look at how and if they provide Narcan to allow students to bring it on campus, provide it to every volunteer individual on the campus who is willing to administer it, where they locate it. We recently put AEDs in most campuses. At a minimum, you would think Narcan would be co-located with AEDs. We have large campuses. We need to look at how closely can we locate Narcan resources. So yeah, there's a lot of work to be done here, and the resources are available, and they're being expedited and getting out to our school districts.
And if I could just provide a little bit of context to that. So upon the situation at Chipman, I took to the Board of Trustees a board policy to expedite us going forward with Narcan in our school district. On Monday night, this past Monday, the board had a special meeting to approve the second reading so that the policy and administrative regulation could now be put into place. So we are working to finalize the training schedule for our junior high middles. We have 10 junior high middle schools in our district. We will train everyone from our school administration to our school nurses to our school office teams to our campus security and yard staff to our classroom teachers and other classified staff in awareness, education, what to look for, as well as seek volunteers who, in the instance where needed, would apply Narcan in hopes of saving someone who was experiencing an overdose. We will then project forward and do the same thing at elementary schools moving forward. But we are a very large district, 34 elementary schools, so it'll take us some time to get through the process. But our Board of Trustees, thankfully, is forward-thinking and forward-looking and recognizes at no time is it worth not having this in place where we could save lives, and that's our priorities to ensure our students and staff are always safe on our campuses. Thank you.
We want to have a community that school districts will only have to worry about educating our children. Today, it's a different world because China supplies the poison and the cartels in Mexico supply the fentanyl that's killing our children. It's the #1 killer of Americans between the ages of 18 and 45. We're losing a generation, and that's got to stop. And that's what today's roundtable was about, and it's what we'll continue to work towards. So thank you for coming.